For this video tutorial, we are going to be scanning the lateral collateral ligament of the knee. Our expensive prop here, no expenses spared, is showing and reminding us that the lateral collateral ligament of the knee runs in the same plane as the lower leg. So a nice tip here is if you bend the knee, then it's much easier to avoid any confusion between the lateral collateral ligament and the distal iliotibial band. So I'm going to remove the guide stick and I'm going to place my probe over and just towards the posterior aspect of the head of the fibula. Okay, so this is the fibula here, okay, this hyperechoic structure, and then we can see quite nicely the lateral collateral ligament, and you can see here how it sags down as it comes off the fibula, and we're following it more proximally. So we're going to follow the lateral collateral ligament now as we go. We have to make some adjustments of the probe because the lateral collateral ligament does not always stay exactly in the same orientation with respect to the probe. We do have to make some adjustments as we go along. So we can see this sort of sags here, and this is sagging under the tendon of the lateral hamstring here. Okay, and we're going to follow with the probe more proximally, just making adjustments, make sure we keep a nice image of the lateral collateral ligament as we go. Okay, and now we're going to come across the lateral joint line, and we're going to go over the top of the popliteal notch or popliteal notch and tendon, and here we see the insertion onto the lateral aspect of the femur. So here, just make this nice and clear, and here we have the proximal insertion of the lateral collateral ligament.